Why you shouldn't use Vicks VapoRub for children under 2. You probably have a jar of Vicks VapoRub on your nightstand. Or, perhaps your parents or grandparents put it on your chest to relieve the flu. Its use is universally known. However, its use isn't just limited to colds. It can also be used for other goals like repelling mosquitoes. It seems logical that some parents think it will also help their babies breathe better. After all, it's an ointment that's been commonly used from generation to generation. Despite this, health experts warn that using Vicks VapoRub for children under 2 years old can trigger more problems than it solves. Unlike children over 5 years and adults, babies' airways are much narrower. Because of this, they become inflamed when the child breathes VapoRub or similar products. When this happens, it produces a larger amount of secretions. Then, their ability to breathe becomes worse. Also, there are specialists that warn that due to the use of VapoRub, some children can have difficulty breathing even when they aren't sick. Because of this, they recommend that parents follow the directions that are written on the container. On its label, it specifies that it shouldn't be applied under or in your nostrils. Similarly, the tag on VapoRub recommends talking to a doctor for use on children under 3 years old or pregnant women. If your child shows symptoms of a cough or flu, we recommend the following natural remedies. Clean your child's nose with a saline solution. The first and most important thing when your child has a cold is to be sure that their nasal cavities are decongested. To do this, you can use a saline solution or sterilized seawater. Then, suck up the mucus with a specialized mucus vacuum for children. This will help them to breathe better, even though it's a little uncomfortable at first. Hydration and saline solutions. To calm a cough, the best thing for your child to do is to get rid of secretions. To do this, your child needs to be hydrated. This way, your child will have less mucus secretions. Plus, the inflammation will go down. Because of this, your child needs to drink enough liquids. Saline solutions are recommended because of their ability to give your child electrolytes and necessary minerals. This will stimulate their organs, muscles, and nerves so that they keep functioning correctly. Air out your house. The environment plays an important role in the health of younger children. A humid environment with dust and even pet hair can cause allergies. This could be both on their skin and in their throat and nose. It's very important to keep your house clean and sanitary. Sometimes, people choose to use humidifiers that clean and humidify the environment when you have a dry cough. If you have any other kind of cough, they are not advised. If you use a humidifier, we advise that you clean it on a daily basis. In addition, don't use it too much so that you prevent mold growth on the walls. Remember that it's important for children to rest when they're sick. This is because their bodies need to be relaxed to heal quickly. When they're babies, the amount they'll need to sleep will be greater. For instance, a newborn needs to sleep an average of 16 hours, spaced out over the day. Likewise, a child of 2 years needs about 12 hours of sleep at night and a couple hours more for a daily nap. Talk to a pediatrician. Sometimes, the cough or flu are passing. Daily home care together with a healthy diet is enough to help your child to quickly get over the sickness. However, you need to see a pediatrician if your child's health gets worse. Only a health professional has the proper criteria to diagnose a disease and prescribe certain medications. What symptoms should make you consider seeing a pediatrician? If the cough is accompanied by fatigue and a lot of difficulty breathing. When you hear strange, sharp sounds like syllables when they inhale air. If the cough lasts for more than 2 or 3 weeks. If they have a fever. When you see changes in the coloration of their lips and face, if they look blue.